This is a recipe for disaster. What is incoming, what is happening, what is going on is going to affect absolutely everyone. And again, it's a slap in the face to so many. Let's get right into today's video. You know that saying, if it's not one thing, it's another? Well, I'm finding that to be true. I feel like several times a week at this point because there's nonstop madness happening every day of the week. I feel like people are outraged right now because the Department of Education is saying that nursing is no longer a professional degree. This is only the beginning, you guys. And just remember that they are also trying to get rid of the Department of Education. So for this to happen, just doesn't make a lot of sense to me. So this one big beautiful bill that was signed in July, this is going to impose a lifetime cap of $100,000 in borrowing for graduate students and $200,000 for professional students. That means that graduates can borrow up to $20,500 each year and professionals can borrow up to $50,000 a year. Starting July 1st, 2026, the law will also end Grad Plus loans, which is the program that many students have relied on to cover the cost of education, not covered by financial aid. You guys, this is huge. As you guys know, if you go into the healthcare profession, it can be costly just depending on what you're doing. So this has the potential to cause, catastrophic consequences. This is going to 100% weaken the funding available to students going into the healthcare field. Keep in mind that healthcare in general has already seen a lot of issues in the last couple of years, especially. We are already seeing, staffing shortages and people leaving the healthcare field because of burnout. Especially during 2020, a large amount of people actually walked away from healthcare, including myself. I didn't walk away in 2020. I was working a lot in 2020, but I actually walked away from it in 2021 in August, maybe September of 2021 to take a work from home position. And at this point, I'm not sure that I'll ever go back to the healthcare field. And why the professional degree terminology is important is because it helps determine student loan eligibility and repayment terms. And nursing is not the only degree being affected. There is a list of degrees considered now to be non-professional degrees. You have nursing, you have PAs, which are physician's assistants. You have PT, OT, so physical therapists, occupational therapists. Keep in mind, some of these degrees, like I know for a fact, PT and OT, both are 8-year degrees because I recently checked into both of them. You can do a occupational therapy assistant and a physical therapist assistant. It does take, less than 8 years. But again, those two degrees specifically are 8 years. You also have audiologists. You have architects, accountants, educators. Educators are already underpaid into, I cannot. Social workers. I am willing to stand strong on these. These are absolutely targeted fields, absolutely targeted. And we are working, when you think about OTs, PT, audiologists, these are a lot of people that work with people with disabilities, educators, social workers, people that we need. Social workers have an overwhelming caseload, and the amount of kids that are in the system and in foster homes and, facing neglect and, abuse, this is going to be detrimental, you guys. But yet they kept chiropractic on here. And no shade, y'all. I have worked for a chiropractor. It's probably been like 10 to 15 years since I worked for one. However, still, they are people that, if you know anything about chiropractors in the medical field, they are seen as like the not real doctors. And again, no shade because I have worked for them before. I think what they do is great, but I'm just saying, if you are familiar with the healthcare field, medical field, you know that you've heard that at some point in time.
Today in my life, my acute care nurse practitioner degree is not a professional degree anymore. And it's giving, give me my money back. I commented this on another video, but it's giving, relieve my loans for my fake degree, please. And I'm not kidding. I'm at a point now where I'm like, if it's not a professional degree, but it's not going to be recognized, if we're not going to bring more people in, if when you go to surgery, you're not likely to have a CRNA do your anesthesia, if when you go to a clinic or an urgent care, you're not likely to have an advanced practice provider like an MP or a PA treat you, I'm giving my money back. And let me be free.
So I am very worried. I am worried what this looks like for a lot of people who are in need of healthcare. You know that we already experience long wait times, even appointment times. I have a child that needs genetic testing, which doesn't change anything in, one way or the other. But our appointment is in March of 2026, and the appointment has probably been booked for like a solid 2 months for genetic testing. Depending on what you are in need of, just know that you will be seeing longer wait times, longer, appointments that are booked out further, and the availability becoming even more scarce. Because we're already seeing longer wait times and, staffing shortages, this is going to be an increased issue because you're going to have people that are worried about and cannot financially afford to go to school to fill these positions and, fill the positions of those that are retiring. So this is an ongoing, chain reaction.
Tell me you want to crash the U.S. healthcare system without telling me you want to crash the U.S. healthcare system. So the U.S. Department of Education has proposed new rules that could reclassify graduate nursing degrees, like nurse practitioners, as non-professional programs. This change would significantly limit federal student loan access for graduate nursing programs by capping the annual loan amounts at a lower level than is currently allowed for other professional degrees like MDs and so forth. So why would they do this? Let's think about this for a minute. Let's look at Project 2025. Nursing is a female-dominated profession. Nurse practitioners, DNPs, and advanced nursing degrees are overwhelmingly filled by women, about 85% according to current data. Any policy change that limits access to advanced degrees or reduced pathways for professional advancement disproportionately impacts women, and they're going to frame it as budgetary reasons. A rule doesn't have to explicitly target women for it to functionally suppress female professional mobility. Project 2025 has openly stated goals like this. They want to return to traditional family structures, encouraging women to prioritize motherhood and baby making. They want to discourage dual income households that rely on government-supported childcare. These motives aren't hidden. These are written in their public documents, right? And advanced nursing degrees give women a high level of autonomy, a higher earning capacity, and leadership roles. And that's the opposite of what traditional ideology and Project 2025 wants. Project 2025 has also repeatedly attacked fields dominated by women. Think about it. Education, 76% women. They want to eliminate the Department of Education, remove credentialing, remove federal loan protection, reduce academic research opportunities for women, nursing and healthcare. They want to shrink the federal support for DNP and MP programs. They want to re-elevate the physician hierarchy because that's more dominated by men.
One thing that I want to urge you guys to do is just make sure you are preparing as best as you can to the best of your ability. If you need to cut costs in one area to focus on another area, even when it comes to food, water, things like that, just a necessity, first aid kits. This is big, you guys. I'm going to go ahead and wrap this video up. Thank you so much for taking the time to watch. Take care, stay safe, and I will see you guys in the next video.